Welcome back, Dr. Krishan. So let's talk about the basics of antibiotics. What are antibiotics?
So they're a type of medication that are used to treat infections that are caused by bacteria. So they work by killing or stopping the growth of bacteria. And these are, when we say bacteria, what type of infections do they cause? So strep throat, which I think we've discussed before, pneumonia, urinary tract or bladder infections, and skin infections. They're the common bacterial infections that antibiotics are very effective in treating.
Okay. So we tend to think about antibiotics being very broad. I want to talk about bacterial infections. How do antibiotics treat bacterial infections?
So, bacterial infections are caused by a bacteria, which is a living organism that's looking to grow and multiply inside your body. So, essentially, an antibiotic is a tablet, generally speaking, or an injection in some cases, that kills that bacteria or it stops it from growing any further so your immune system can attack the bacteria and so that it can't cause the disease that's caused by that infection. And antibiotics been around for a very long time and very effective in combating those bacteria.
Okay, that's helpful to know. One of the things that I know there's been a lot of discussion about lately is antibiotic resistance. What is antibiotic resistance and why is it such a concern?
Yeah. So this is a real concern and a very topical issue at the moment. So essentially what it means is that an antibiotic that used to work for a certain infection once upon a time doesn't work anymore. So it used to be able to kill that particular type of bacteria, but it doesn't anymore because the bacteria has changed. It's evolved to protect itself when the antibiotic is trying to attack it. And this is obviously a big problem because it makes it harder to treat certain infections. So people can be sick for longer. And in some cases, if there are no alternative or other antibiotics for that particular type of infection, it can be deadly because there's no other treatments available.
Well, that's a bit wild and also incredibly scary, if I'm to be honest. So let me ask you this question. How common is an antibiotic resistance and what will cause it?
So it is becoming more common in Australia and actually around the world as well. And there is some Australian, government data that showed, really estimated that between 2015 and 2050, more than 10,000 Australians will die as a result of antimicrobial resistance. So that means they'll get a infectious illness that in the past we had an antibiotic that worked, but because of antimicrobial resistance, there's no longer an antibiotic that's effective in treating that infection. So it certainly is potentially, or it is a very serious problem, and we need to really, fight it by making sure that the antibiotics that we have at the moment, that we're using them properly, and we're only using them when necessary.
That is an unbelievable number, 10,000 people.
Yeah, that's what the estimates are.
Wowza. Okay, so if this is an evolving kind of issue, right? How do we prevent the antibiotic resistance?
Yeah. So there's really
Or is it preventable?
absolutely it's preventable. So there's two really key factors here. So the first is that we don't overuse antibiotics. So when you go and see your doctor or your health worker, and you've got an infection, ask them, do I need antibiotics for this? And or do you think it'll pass without antibiotics? So you only use antibiotics when it's really necessary. The other really important thing is if a decision has been made to use antibiotics, that you complete the treatment course, whether that's one box or two boxes or however long it's been prescribed. Make sure you complete the treatment course, even if you're feeling better. And usually when you start antibiotics, you're feeling better within a few days, and it's tempting. Oh, do I really need to complete this 2-week treatment course? You absolutely do, because if you stop taking your antibiotics just because you feel better, what can happen is there may be a few bacteria that are still in your body. They're not enough to make you feel unwell, but they're still there. And so then what they do is that they evolve, mutate, they change their shape or change their composition so that the antibiotic doesn't work anymore. And then you may spread those bacteria to other people. And then, you're not feeling sick, you got better after 3 days, but then there's essentially a new bacteria that doesn't respond to this antibiotic anymore. So someone else who does get sick from that, modified bug, the antibiotic is not going to work when it's prescribed for them. And that problem can multiply and multiply, and you can essentially develop new bacteria that don't work or that don't respond to the current antibiotics we have.
Okay, so core messages right here are to meet with your doctor, your healthcare professional, have a conversation about what's going on with your body, symptoms. If you are prescribed medication, a treatment, you are given a treatment plan, and it includes antibiotics to complete all the tablets or all the course of what the treatment is. Don't stop because you feel better, because there is resistance. You can potentially get antibiotic resistance and treatment is not done properly and the illness can hang around, right?
Absolutely correct. Yes. Yep. It's
Okay.
very
All
important.
right.
Use antibiotics only when necessary, and if you are using them, finish the pack.
Yeah. Okay. All right. Is there any other things that we can do to prevent antibiotic resistance?
Probably I suppose the other way is to minimize infections that are going to need antibiotics in the first place. So we know how most infections spread. Wash our hands often, practice good hygiene around the home or where we work. Cover your mouth when you cough or sneeze. Don't share personal items like, towels or razor blades. These kind of, healthy habits will stop bacterial infections from spreading in the first place. And so if you don't spread, that means there's less people that need antibiotics. And so there's a lower likelihood of developing antibiotic resistance.
Awesome. Well, thanks so much for that really helpful and insightful advice. Once again, Dr. Krishan, you have answered all the questions that I've got. So thank you very much for taking the time to talk with me today.
Great. Thanks for having me, Dixie.
Thanks.